Clemency,
Yes.
you're clinical lead for IAPT services for the Dr. Julian Medical Group.
Yes,
What does
that's
that
right.
involve?
So what that involves is we provide CBT through a video, audio or live chat format for the IAPT services throughout the country. We have very well qualified therapists and they provide evidence-based therapeutic interventions for a variety of presenting problems.
Do you use artificial intelligence in any of your systems?
We don't use artificial intelligence in any of our systems, but that is something that we've been thinking about integrating for the future. We have a number of therapists who are qualified in avatar and virtual reality therapy. But at the moment, it's all person-to-person contact and connection.
Tell me about your learning experiences of implementing an online video platform.
Oh gosh, so a lot of it's been a learning experience because our company has been starting from fresh, and so we've been paving the way in whatever we're doing. So everything has been learning from the beginning, basically. One of the things that we've really learnt is that a lot of patients are enjoying having the choice of doing online therapy if they want to. A lot of people are choosing it as an option because our waiting lists are much reduced. It's much more efficient, it's much more cost effective, so they can get therapy in a way which suits them without having to compromise on quality.
One thing we found for online presentations that have been given, online mental health presentations have been given at the Royal Society of Medicine before, is that a number of the people who have come here have claimed that their systems are more effective than face-to-face. Do you have the same experience?
Our systems are different. We do a lot of communication via emails. We do a lot of triaging to make sure that we can match up the right therapist with the right clients, and that always isn't something that can be done face to face because obviously it's who's available at what time. It's different because we're not in a service. The clients don't come to us, they don't sit in a clinical room. We are connecting with the clients in their own environments and at times which suits them. So we do a lot of out-of-hours appointments and clients get to be in their own home and have the comfort of their own home, but that also means that our therapists get to be in an environment that they feel comfortable. And so we find it works really well for both the therapists that we employ and also the clients that we help.
Excellent. Anything else you'd like to mention?
I think that with any system there are imperfections, and one of the things that's really important about implementing new online interventions is to make sure that we really reflect on what's working and what can be improved. And I think that that is a standard of quality, is that we can always be improving. So one of the things that we really focus on in Dr. Julian is to keep implementing changes, to keep taking the viewpoints of both our clients and our therapists into consideration, to make sure that we are constantly evolving and adapting to create a product which is really effective for everyone that tries to use it.